Hey guys, in today's video, I want to talk about what you can do if you have trigger finger. First things first, if you think that you have trigger finger and it doesn't go away, you should get it checked out by your doctor. They'd be able to refer you to a hand specialist who can help you get the treatment that you need, whether that be a cortisone injection, an anti-inflammatory or other medication, a referral to hand therapy, or surgery. Secondly, if you have a triggering finger, don't play with the clicking, okay? Every time that your finger gets locked or stuck down, the tissue gets irritated, the tendon, that synovial tissue around the tendon gets really swollen, and it actually makes things a lot worse. And if you're having pain, it's good to use ice or heat. Either is pretty good. The only thing is that if you've had symptoms for less than 3 months, I'd recommend ice a little bit more than heat just because it will help to reduce that inflammation. But either are okay for pain. Okay, so I want to show you guys some finger exercises that can help with trigger finger or trigger thumb. These stretches will keep your fingers moving without causing that finger to lock up or get stuck. If you do try the stretches and they do cause any clicking, sticking, anything like that, please stop the exercise because you know that just makes things worse. In this first exercise, you're going to hold the middle joint to keep it from bending and then actively bend and straighten the tip of the finger, nice and slow. And in this exercise, you're going to hold the big joint and actively bend and straighten the middle finger. I would recommend doing these stretches with 10 repetitions 3 times a day. And if you've got a triggering thumb, you're going to do the same exercise, but just holding the bigger joint of the thumb and bending down just the tip, okay? All right, so if you guys had clicking with the last exercises that I just showed you, these next ones are going to be the ones that are going to be right for you, okay? So in the first stretch, you're going to use your other hand to hold the middle of the finger, and you're going to just bend down that tip, okay? Really slow, just like that. And the second one, you're going to hold the finger so that you're just bending the middle joint using your other hand to help it out, okay? These ones I would do nice and slow, about 5 repetitions, 3 times a day. Now, it's worth noting that when you've got trigger finger, those stretches that I just showed you will probably cause a little bit of pain, maybe some discomfort, some soreness. That's definitely normal. The discomfort should decrease over time. If you're doing these stretches, very consistently over a week or 2, you're going to start to get used to doing them. You can always use ice or heat after your stretches to help relieve some of that pain. But it's worth noting again, if any of these exercises cause your finger to click, stick, or lock, don't do it. All right, I hope some of these ideas help you get started. They're just a few suggestions, quick tips, stretches that might help with your triggering finger or thumb. Thanks for watching, you guys, and stay tuned for the next video.